And here we are in our broker dashboard. Very detailed dashboard. As you can see, we just have a quick highlight of what this program is about. And we're going to go starting in kind of a row format. Right next to the orange image, we have here November 2016 commissions. And I can see that my total commissions for this month is $1,363.37. And we show a breakdown of what that is. So we see here retail, and then we see group, and then we have our downline group and our downline retail. Now for us, we do have a retail product that is direct to consumer focused. So MyTelemedicine has recently launched our new website called accessadoctor.com. And accessadoctor.com allows consumers to be able to go and enroll right from the website. And this is a direct to consumer plan. And if they wanted to, they can simply go start the membership. And there they go. They select family, they select individual, and now they're able to put all their details in. And they're then also able to put their credit card information in, and they are now able to enroll in the service. So Access a Doctor is our retail product, and this is how consumers can sign up on an individual level. Our individual plan is $24.95 a month for a family with unlimited access to the service and zero out-of-pocket consultation fee. And the individual plan is $12.95, and that allows them to sign up as an individual. Again, unlimited access. And this is for those partners that do go after the consumer market. A lot of our insurance agents that we work with and brokers do have clients that are individual. They do go after the individual market, and they wanted a tool to be able to enroll those people, and we provided them that tool. So you can go in here and you can see your retail commissions. You can also see group commissions. So if you're going after a company or an affinity group, and you're now able to see the commission. So as you can see here, I only sold a couple of counts this month on the retail side, so I have about $9.98 in commission. My group, which are my employers and my groups of any size above 1 or 2, I have almost $1,350 in commissions. And as you can see, if I just hover over that detail, it'll give me a breakdown of what this is. Group commission based on default grouping pricing tiers, and it will now give me that information. So I can quickly see a snapshot of my commissions for my business during the month of November or the month that you're in. Going one level down here, we have active members. As you can see here, I have 801 active members that I've enrolled. Right underneath that, I have 10 groups that I have enrolled into the system. I have utilization right here just for the month of November. And as you can see right now, there's almost a 5% monthly utilization, which on an annual level is close to 60% annual utilization. So we're very focused on engagement, a lot of drip marketing, text marketing. We do want to encourage the members to be able to utilize the service because, of course, that's where the consumers see the value, or the member sees the value, is once they use it. That's when the aha moment occurs that, wow, I was able to pick up the phone, connect with the doctor, and this doctor was able to not only provide me the advice, but a diagnosis, which resulted in a prescription being called to the local pharmacy of my choice. So as you can see here, we have a total of 801 active members that I've enrolled. Completed consults was 38, which gives me a 4.7 utilization rate for the month. And if we look at some of the common trends that are going on in the space, there are some other companies that are very engagement focused and have high utilization as we do on an annual basis. But the common trend from some of these larger providers are very low usage models, some sub 1% utilization. We want to encourage utilization, and this really provides them with those tools. Right underneath that, as you can see here, we do have, based on national statistics, some potential savings, right? With the average consult doctor visit, primary care, urgent care, an emergency room at, $1,233, if that 38 consumers went to an emergency room or primary care, the cost, as you can see here, would be dramatic. And that's why telemedicine really does show the savings. This next panel over here, as you can see, we have a trend of enrollments over the last 6 months. As you can see, there's two blocks on each month, and one shows retail members and one shows group members. So I can see here that I enrolled 13 group members, retail members 0 in September. In October, I had 9 groups. And in November, I had 2 groups and 1 retail member. And I'm able to see that over a 6-month basis. And of course, if you go into any of the tabs, you can see these reports in a more detailed process. So right now, we're going to go ahead and dive into our retail management section. As I did tell you, we do give you the ability of creating, of enrolling direct-to-consumer members. So it doesn't always need to be a group that you're enrolling. If you know a friend, a family member, or you're talking to your clients, especially with the rising cost of healthcare, this year alone, the healthcare costs have risen on an average of 25%. Most of these policies are high deductible policies that are being offered by corporate programs, because insurance is mandated and mandatory to be provided to their employees. So employers are looking for ways to reduce costs. Consumers are looking ways to not only reduce costs, but still get access to care, especially when they don't have that deductible. So a consumer retail product is a great complement to add to any benefit package at an employer level. And it's also a great benefit to add when you're selling consumers. You can sell a consumer now a high deductible policy because unfortunately that's all they can afford, and then complement it with a $25 monthly product that then gives them access to doctors 24 hours a day, 7 days a week. And if I wanted to go ahead and enroll a group, one of the things that we did create here also is a tool that we call a campaign manager. And what a campaign manager does is a lot of our partners and our brokers have told us sometimes they go after specific groups. For example, let's say you're going after a trucking organization, and you wanted to create a special promotion code just for that trucking group. So our retail price, as I told you earlier, is $24.95 and $14.95. And that is our retail price to the consumer, to the average consumer that comes to the website. So maybe they're not referred by a broker. They're just doing some Googling. They found us and now they want to enroll. They can go ahead and just enroll for $24.95 or $14.95, as you can see here. However, our partners have the ability of creating special promotion codes. So if I go into my broker portal and I click create new campaign, I can go in here and say, hey, you know what? This is a webinar. So I'm going to go ahead and create the promotion code webinar. And I'm going to verify that that promotion code is available. And it is available. So I'm going to click save code. And as you can see right underneath, new codes are automatically assigned in special pricing, which is as follows. So rather than $24.95, which the average consumer will see for a family, or $14.95 for an individual, your special promotion code gives you now $19.95 for a family and $12.95 for a individual. So now not only are you able to enroll that person, but you're able to give that person special pricing that other consumers that come to the site don't have. So this is a really great function. And if I just come right back to my site here and I wanted to enroll, and now that my actual webinar tracking code is active, I can just go in here and click webinar, enroll webinar as my promotion code, apply code, and congratulations, your promotion code secured, special pricing just for you. And as you can see, if I close this out, my pricing automatically went down from $24.95 to $19.95. So for those brokers out there that are targeting specific groups, specific markets, and want to be able to track campaigns on an individual basis, or even just offer a special promotion. Hey guys, if you sign up yourself and went to the site, it's $24.95. But if you enroll with me, I can get that down to $19.95, which is almost a 20%, 25% savings. Here, this webinar, this promotion code, as you can see, webinar was the promotion code we used, gave them that special pricing. So now, if I wanted to use that, I can go in here and create my promotion code. Once I have my promotion code, that also then gets attached to a actual URL. So let's say you're going to do an email marketing campaign, or let's say you wanted to promote this on your social media, on LinkedIn. You wanted a dedicated link that takes them there. If you just click this link right here, it'll actually open up the window. And as you see, it's opening up that window. And as you can see, that code webinar is already there, and it is tied to your broker code. Also, if I just wanted to click this to copy the link, I can just click it. The link has been copied. And if I just come over here and paste, you can see it's automatically in there. And again, it does give me my special pricing. So you can now go ahead and promote. And whenever somebody does enroll, as you can see, based on your campaign, you can see the total enrolled members. You can see the primary members that are enrolled and the total members that you have. And if you actually wanted to see the details of those members, you can go ahead and just click your campaign, click members, and now you can see, okay, what members signed up. So even though they're signing up for Access a Doctor, you still get that person's information because they are your client, because you brought them aboard. So I can see here, Jason Valdez signed up. He enrolled for the family plan for $24.95. There goes Jason Valdez's information. So you, as the broker who brought that person in, can now reach out to Jason and say, hey, Jason, thank you very much for signing up with me. If there's anything I could do, please reach out. So you'll always have contact information. And if I wanted to enroll a member right from the back office, again, I'm in here. I was looking at my group. I'm under a special group. So let's say you're face-to-face with somebody and you want to enroll them yourself. All you have to do is click the add button, and right away you'll get immediately into an enrollment page. As you can see, you're already under your webinar promotion code. I select, okay, is this an individual or family? This is a family plan. I put their information, their address. I collect their billing information, card number, expiration, and CVV, paid $19.95, and that consumer is automatically enrolled. In a millisecond, they're going to get an email, and they'll be immediately activated into the service, and now they can start using the service immediately. So this is our consumer enrollment module. We are creating videos that will go over each module on a case-by-case basis, but this is how you, as a partner or broker of ours, will now be able to promote MyTelemedicine to the direct-to-consumer market. For those brokers that are going after the group management, and just really quickly, guys, I do see that we're getting in some questions. What I'm going to do is I'm going to wait till the end. That way we can go over all the questions all at one time. So if you do have any questions, just go into your panel, hit the chat button, and you can ask a question. And then at the end, we will get to those questions and answer some of those. This next section here, guys, as I mentioned, is our group management section. And most of our brokers go after employers. Some of these employers can be 500-man companies. Some can be a 5-man company. At the end of the day, we want to be able to bring our services to every employer out there. And I have to say, guys, this is an amazing tool that we created, because not only can you do auto enrollment right from this back portal, but it's immediate activation, or you can set the activation to a 15th of the month or a 1st of the month. But if you brought in a group right now and they made their payment, you can go ahead and get them immediately enrolled into the system, to include uploading and downloading eligibility census files. So most companies that are out there, they have these antiquated SFTP servers that you got to upload eligibility documents. You got to tie it to APIs. Most brokers or the employers, they're not very tech savvy. They really don't understand how to really manage that. They have all these special formats for these eligibility templates, and it makes the process, it creates a lot of hesitation or agitation in the sale. And this is feedback that we got from our partners. So we said, let's create a tool for that. So in here, you have the ability of managing groups. So let's say I just met with ABC Corporation and I wanted to add that group here. As you can see, in every section at the very top, we have this instruction panel that will show you the instructions on how to utilize that page. But if you already know and you just want to hide that section, you just click hide, and now that's gone. So in our group management section, the same thing. Click add new group. Be sure and complete the group details, contact information, and plan details. As you can see here, we have group pricing. That's by default set up in the system. So if I was signing up a 50-man group, I would know that that would be a $7 per member per employee per month. And that per employee per month cost does include their family members. If I have between 100 to 249 members in a group, I would be paying $6 PEPM. If I have 250 to 499, I would pay $5 PEPM, and 500 to 750 a $4 PEPM. And anything above 750, give us a call, work with your partner team, which are always on standby. So if you ever have any questions, you want to talk to somebody about the partner program, you have questions about the back office or about enrolling a group, or just want to learn more about MyTelemedicine, do not hesitate to call 1-800-611-5601 and press the prompt to talk to our partner team, and you'll be immediately connected to a member of our partner team to answer any of your questions. Once you're done, if you have hide this section here, I am now able to see all of my groups that I have here. As you can see, I brought in Access a Doctor and they have 18 employees. We brought in Group 1 and they have 741 employees. Jesse's Group 1 has 2 employees. MyTelemedicine has 15 employees. So I can see all of these details of this group. If I wanted to see, okay, well, let me view the members that I have under this Access a Doctor group. And this is an employer group that I brought in. I click members, and there goes all the members with their details right there. So you can automatically see them. You can disenroll them also on behalf of the client. So if a client called you up and said, hey, I just fired Alexandru Trican, can you do me a favor and delete him? I can just click here, click the X button, and as you can see, he's now disenrolled from the system, and no longer will he be able to have access to the service. And this is a feature that you would be able to offer your clients. So you're being more hands-on. Of course, if the client wants to manage this themselves, they can do so, but you as the broker who manages that account can also do that for him. If I go back to a group and I wanted to add a new group, I can simply go in here, click add new group, and I can go in here and put the company name. So I can say, hey, you know what? I just signed up Burger King, and here's their website. If they have a phone number, the address of that company, the state that company is located in, of course, all their details. Here we have fulfillment. So sometimes a client wants hard card fulfillment. As you can see, we charge $1.25 one time per member, and that's for hard card fulfillment. Or for e-fulfillment, which is via email, there's no additional cost for that. All you got to do is say, hey, this group wants to have e-fulfillment. Now I'm going to put the contact information for the group, the title of that contact person. So here I would put, Joe Stevens, and he's the CEO, and I put his phone number. And let's say he was the billing contact. I can say put same as the daily contact. And let's say he was also the technical person. I can put same as technical person, or I can go in here and just change. No, actually, the technical person is Alexandru Trican. He's their help desk coordinator. And he will be able to cut, copy, and paste all the technical details that are needed in order to make this happen. And now that group. And here I'm able to customize his plan. So of course we have a basic plan that has a $35 consultation fee. And then we have an enhanced plan, which has a $0 consultation fee. Or maybe they want something custom. Of course you would work with us in order to do that. But you can just select the plan design right here. Maybe they want 2 plans. They want 1 enhanced plan and 1 basic plan. You can go ahead right here and click save. And now that group is set up. So once they're set up in the system, I can now go to the group and I want to add eligibility. So let's say I just added this group and this group has 0 members. And now I'm ready to get their eligibility file. You just click this button right here. This is eligibility template. And as you can see here, when I click it, I can download a template. I could download a template with example data, and I even have instructions. So for those people that aren't as tech savvy with eligibility templates and you have questions about it, you click instructions, and there goes all the instructions on how to set up your eligibility file. And it's very simple. There's a column that says first name, there's a column that says last name, there's a column that says enrolled or disenrolled, there's a column that says primary, spouse, or child. And all you're doing is you're filling this information out, or you're having your client, the employer, fill that information out. So if I wanted to go ahead and download a template, for example, with example data, I click download template. As you can see, a CSV file just downloads to my PC, and I'm going to go ahead and click that. And there it goes. There goes my data right here, status, ID, primary, all the information on the employees, phone numbers, emails, status, gender, date of birth, the effective date. I can say, hey, effective date is going to be 20/12/1. And what's really exciting is for those that clients, those brokers, those partners that go after the Hispanic market, as I said earlier, we are the only provider in the market that offers a complete Spanish experience for the Hispanic market. And what do I mean by that? I mean that members are able to log into the portal. They're able to have the portal by default be set as Spanish. So if you have a group that you just brought in, and let's say all their employees are Spanish, you can just go in here and select language and put ES for Espanol or EN for English. And now by default, that member will get Spanish marketing collateral, Spanish emails, and they'll also be able to log in and to their back portal as a member and have everything in Spanish, manage their medical records in Spanish, connect the doctors by phone and by video in Spanish, talk to customer care representatives that are in Spanish. And one thing I do want to highlight about that, everything we do is all in-house. Nothing about our service is outsourced. We don't outsource software development. We don't outsource physician recruitment or our physician network, and we do not outsource our call center. So our call center is right here in McKinney, Texas, just about 20 minutes north of Dallas, and we welcome any of our partners the opportunity of coming up and visiting us so you can see exactly what we have. But here, they download the template. Once the template is completed and they're ready to upload that template, they can now go here and go to that group and click upload. And all they got to do is select that file wherever it's at, upload the file, and now the file would automatically be uploaded into the system. And now my group is activated. And if I wanted to make any edits to the group or view the members of the group, as I told you earlier, you just click members and you would see what members were enrolled in that group right there. So this is the, again, the group management section. Always remember, if you have questions or need to know how to use, you just go to the right button right here and click how to use. And there goes all the instructions on how to use this for your clients. The next section we're going to go to is broker management. And this is a really exciting function that we brought in because this allows brokers who have other brokers as their contacts and they're also out there selling. Well, you're now able to get compensated for their sales efforts. And the way our commission structure is set up is we do have a 40% commission, which is the highest commission in the industry right now. And we're able to offer 40% commission to your direct sales. And let's say you signed up your friend John, and John is now a broker. He becomes your downline. Just like an insurance model, we have a master agent and a general agent, same structure. You're now able to enroll John. John's able to go out and you're going to make 10% of all of his sales. So as you can see in my broker management section, I have 3 brokers underneath me. I have Michael Broker, I have John Smith, and an Owen Broker. Owen and Broker is from Benefit Brokerage Firm. John Smith is with Smith & Smith, and Michael Broker is with MB Firm. There goes the details of their company. And let's say I'm talking to a buddy of mine and he says, yeah, man, sign me up. I'm ready to enroll. And that way he can become a broker also. All he has to do is click register broker. And immediately the enrollment page comes up. As you can see, it's tracked back to him. So that way he would automatically get credit for this person for enrolling. If I wanted to email this thing, let's say I was just talking to a friend of mine and I said, hey, I'm going to go ahead and email you the link so that way you can sign up. I just click copy link and now I'm able to send them that link. And once he clicks that link, again, he'd be able to enroll and now he's signed up underneath me. So now our partners, our brokers, our resellers are able to sign up downline agents and make commissions only on their direct levels. So this isn't any type of marketing program. This isn't multiple levels. This is only one level underneath you for agents that typically have an agent and are used to the agent model and want to get commissions and benefit from people that are out there selling on their behalf. The next section that we have is our prospect management tool. And this is a tool that allows you to manage your leads. So let's say you just talk to a client, a prospect, they're interested, and you want to add them as a lead so that way you can manage them. You can now go in here and add a new lead. So if I wanted to add a new prospect, I go in here, add new prospect, and I'm going to go ahead and put new prospect is Ray. And the estimated member, he has a company with 50 employees. His website is www.ray.com. And I'm going to put his address, 123 Any Street. And this is in McKinney. We're going to go ahead and just fill this information out real quick. That way you can see how I'm able to automatically add this lead into the system. Ray is the contact. He's the CEO of the company. There goes his phone number and email, and add his information in here. And now he will get saved as a lead. Same. We're going to go ahead and save him. And he now be up. It's asking me for the phone number. All right, let's go here. What am I doing? Real quick. 214-449-6041. And then email, I'm just going to put ray@mytele.com. And I'm going to go ahead and save him. And same as contact, same as daily, save. And now there Ray goes. Ray is now a lead. So as I'm managing him through the sales process and he's now able to enroll and sign up, I can click this button here, convert to a group, and clicking yes will remove this prospect and convert them to an actual client. Are you sure this prospect is ready to be a group? You can click yes, and this client now becomes an actual group. So if I go back to my prospect management, I'll see over here. If I go to group management, of course, we're still waiting on some of his documents to get put in the system, but he will now come out of his prospect management and into his group details. So that was the prospect management. That's for people out there that are generating these leads and want to effectively manage these leads. They can do so. So this tool that we've created, this portal, provides you the ability of enrolling and managing consumers. It gives you the ability of enrolling, activating, implementing groups. It gives you the ability of managing brokers as a downline, so that way you can make commission off of some of your contacts that you have within the space. You can manage your leads as a prospect management tool. And then now, last but not least, is marketing resources. And of course, we know that there's going to be times when you want some marketing collateral. Maybe you have some questions. So we have some articles in here that we created, getting started, how to get started with MyTelemedicine. We have some online marketing tips for those guys that are going after the online marketing world, want to do some pay-per-click, some display advertisement. We give you some tips on how to use online marketing. Again, you do get a dedicated URL. And let's say you wanted that dedicated URL pointed to your own domain name, MyTelemedicine.com. You can go ahead and do so using URL forwarding. We also give you some tips on just traditional marketing, offline marketing. For those that are going to do a little bit more online pay-per-click management, we give you some tools and some education on how to do pay-per-click management. And most importantly is marketing collateral. So if you had some marketing collateral, let's say you wanted to download a marketing piece and you needed access to that, all you have to do is come in here, and here, this is a promotion card, almost like a business card or a promo card that you want to hand out. You can just click download this PDF. And as you can see, it's now opening. And here's the card. I'm going to go ahead and reduce the size of it so you can see it. This is the actual card, but if I go to page 2, get access to care, you can put your information here. My promo code is webinar. And if they enter webinar, and now I have this printed, and now I can go out there and say, hey guys, go to accesstodoctor.com, enter the promo code webinar for special pricing, and now that person will automatically get tracked back to you. So this is auto-fillable marketing collateral that you have and that you can use. You can download any one of our collaterals right here. Here goes another piece targeting the Hispanic market. Again, we want to provide collateral that you need. So you have any ideas, any marketing collateral to offer and to promote to your client base, just let us know and we'll create something. We do have marketing collateral also in Spanish for those that are going after the Hispanic market. Again, I could download this marketing piece right here. And as you can see, everything is in Spanish. And now you're able to promote this to Spanish clients and bring them in as well. And of course, for those that are going after the broker world or wanting to increase their downline agent base, they can just go in here and download this. It's just that simple, 40% commission. And now you're able to go out there and build yourself a great business in a great market. And what's really exciting about our commission structure, everyone, is that it's uncapped and unlimited. So it's not like after the first 3 months or the first 6 months or after the first year, we're going to reduce your commission. Your commission is for the life of the program. So we're really excited. And the very last section, which everybody always asks about, and there's really not a lot of tools out there that provide this type of reporting, but we have a reporting module. And as you can see, I can look at my commission reporting for groups. I could look at my commission reporting for retail, and I can see my life commission agent reporting, and now I'm able to manage all this business right from within our portal. So again, just as a recap, the core functions of the MyTelemedicine Partner Program portal allows you to enroll consumers on an individual basis, families and individual consumers. It allows you to enroll groups and employers. So if you have a 1-man group, a 50-man group, or a 500-man group, it doesn't matter. Easy enrollment, easy activation, and the group's enrolled. You're able to manage your broker downline, so that way you can make extra revenue off of your brokers that are out there selling. And again, we provide you the marketing tools and the resources needed to do it. So this right here is what we like to call phase 1 of the partner program. We are coming out with some agency tools for those that have insurance agencies with multiple brokers within their business. We will be rolling out a function very shortly that is going to allow agencies, TPAs, brokerage firms the ability of managing all their agents in one level, in one area. And now they're able to split the commissions as they see appropriate, see reporting not only on the individual, but as an aggregate level for all of their groups. So there's some exciting functions. And again, this tool was really built by our partners, by you guys that are out there. You guys provided us the feedback. We heard your complaints, right? Whether we talked face by face, whether it was over a lunch or at our office, you shared the concerns that you saw in the market today, and we wanted to create a solution for that. and that's what MyTelemedicine has done. So we're really excited. Again, share with your friends, share with your business associates this program. We really want to go out there and build a great company, but more importantly is we want to provide great service, and great service isn't always to the clients and member. Yes, that's number one, but it's also great service to our partners. And without you guys, we wouldn't be here. So we're really excited about this partner program and everything that's involved with it. As I did mention earlier, we do have a dedicated partner team in-house. So if you have any questions or concerns, feel free just to pick up the phone, call a member of our partner team, and they'll answer any of your questions. Our Vice President of Partnership, Wayne Orchard, is also always available. And mostly everybody in the market knows Wayne Orchard. He comes from the benefit space many years, and we're excited to have him part of this team. And it was really his vision around creating this partner program and all of his years of experience that he's had working with partners and overseeing these type of programs in the past. So with his insight and leading this program, we're really excited to see where it goes. So know once again that our team is here. So really quickly, we're going to go ahead, and we're almost done, but we are going to take some questions. Let me see if I can figure out how we get these questions here. Q&A, your Q&A. Okay, so let's see here. Let's see, guys, where are these questions at? I don't see questions, so come over here, somebody, and give me a hand where these questions are. All righty, we're gonna quickly, let's see here. Maybe it's chat. No, no. Might have some questions. We might not have some questions. Of course, we're trying to figure this out right now, guys. If we don't figure this out in the next 60 seconds, I promise you everybody will be able to, okay, so read them out to me. Give me a question. Give me a question, guys. Okay, guys, this is so important. I'm glad that you say this. We are the telemedicine provider. There's nobody else here that does anything. We recruit our own. We're not a reseller. We're the actual provider. Just like some of the big names that are out there, we are the providers. So we built our own network. These are our doctors. We do our own recruitment. We manage our own doctors 24 hours a day, 7 days a week. We have our own call center, all of our technology. So we are not a reseller of any level whatsoever. You're working directly with a national player. Yes, you have the Teledocs of the world and the MD Lives of the world, but rest assured, MyTelemedicine will make a big name this year because, again, we are our own provider. Next question is, let's see here. Can the marketing materials be customized with our names and numbers? Yes, great question out there. Dan, that was a really good question. Yes, all of the pieces that we have will be customizable. So at the bottom, there's going to be fillable forms, very much like that promo card that I show you, rather than saying visit, or call 1-800-611-5601. You will be able to go there and put your phone number, put your name, or put your email, and you will be able to do that all yourself. So yes, all of the marketing collateral is customizable. And guys, if there's any other marketing collateral that you need, call up your partner management team and they'll be able to assist you also. Do we have pre-made digital ads in banner and medium rectangular sizes? Ziller, great question. We can definitely provide those for you. Our in-house marketing team is constantly adding new marketing collateral. And yes, we do have a bunch of digital banners that we've created for 68 by 60s, you name it. We do have those. We are building out the production of those now and should have them. If there is a special need that you have right away, give us a call. So that way, those of you that are going after the online market and want to do some digital marketing, we have those capabilities as well. So yes, we will be able to. And that's where that link comes in, because you're able to track that campaign with the link that we for a dedicated campaign. So let's say you're doing an ad on Google. You can now create a Google campaign and you'll be able to do that. And okay, so we have all these questions. Okay. Yes. Okay. So we do service every state. The only state that is not serviceable for any provider in the U.S. is the state of Arkansas as of right now. So we are a national provider. We do have national coverage. We have doctors, both English and Spanish, in every single state, including Puerto Rico. Please remember that we are a national service provider and we do cover the entire nation. Does our broker URL have our information? Absolutely. So as I told you earlier, if you go out there and let's say you created a campaign, and right here, this webinar campaign that I created was specifically for you. So that promo code webinar is tied to you as the broker. So if you enrolled an ADR broker as the person, if anybody was ever to go to Access a Doctor and type in webinar, or this URL, if they clicked it and it opens it up, that webinar is automatically tied to you. So nobody, if anybody ever used this URL, you're going to get commissions for that. So yes, all these URLs, even though there's a promo code that says webinar or truckers or whatever you want to call that webinar, that group, then you will be able to always get tracked, and those commissions and those enrollments always go back to you as the broker. All right, well, it looks like those are the QAs that we have. Okay, next, okay, we do have another question that just came in. Do we have a consult fee or is it just PMPM? You know, guys, I have to tell you this. We get that question a lot. We have companies out there that are doing this per occurrence model. And I would say contact a member of our business development team and they will be able to answer those questions for you. As far as our reseller program is concerned, these are all per member per month models. However, if there is the large enough opportunity that we want to consider a per occurrence model, then we would do that. However, I will say, coming as an industry veteran and someone who knows this space, there's no adoption around that per occurrence model. The consumer mindset isn't aware of telemedicine. They're starting to learn about it. I'd say over the next 12 to 18 months, there's going to be much more education and that paradigm shift is going to occur. But if you add a $45 per consultation fee or a per occurrence model, you've just created hesitation or agitation in what becomes the sale. So the likeliness of utilization is going to be very low because members are already uneducated and now they got to be paid to just pay for it just to see if it works. That's where the problem comes in. So we are open to per occurrence models on a case-by-case basis, but the programs that we have here right now by default are strictly subscription-based models. Good question, guys. Okay, what is the average time? And we will have another webinar very soon to really go over all these details, but the question that just came in is, what's the average time that our doctors respond? So we guarantee a callback time with one of our physicians within 2 hours. However, right now, our average callback time on a national level is 23 minutes, and that is constantly improving. 3 months ago, we were at 29 minutes. So our internal physician management team that's now overseen not only by Rosie, but by Jason Martinez as well, is constantly working with our physicians. We are encouraging them to get to these calls quicker, and the numbers are showing it. So right now, our average callback return time for a consultation on national level is 23 minutes. All righty, good. Well, you know what, guys, I'm very excited about everyone that's been on this call. We had over 50 attendees come in. We do want to let everybody know that we had a raffle going on. This raffle was for an Amazon Echo Dot. And for those of you guys that are familiar, you know how exciting Amazon Echo is. You always see the commercials. Alexa, what does the weather look like today? And little speaker talks back to you and says, looks like the weather's going to be 75 degrees in McKinney, Texas. Or Alexa, who won the presidential election? Oh no, it's Trump. Yes, it speaks back to you, and that's what Amazon Echo Dot does. And we have done our raffle, and Shelly Cooper, you are on this line. We're really excited. So we have all of your contact information, Shelly Cooper, and you are our winner of our raffle today. So we're excited. Please contact us. We do have your information also, so we reach out to you so that way we can get your address and we can mail this to you. For those of you that have not enrolled into the partner program, again, remember, go to MyTelemedicine.com, click the partners tab, and go ahead and enroll. Immediate activation, and you can start selling this. And one last thing, guys, every enrollment that we have set up here is an immediate activation. So if somebody signs up right now through you, in 1 minute, they can use the service. So we're really excited. Keep up the great work. Provide us more feedback. Send us emails. Tell us what we do right. Tell us what we do wrong. Tell us what the industry is doing. Tell us what you want to see in the market and what you're hearing from your clients. Because with your input, we're going to be able to really create a solution that's going to change the way healthcare is accessed. With that, we are all done. We came, we saw, and we conquered. Till next time.